Today's lesson plan will be on sexually transmitted infections or STIs in adolescents. The setting of this lesson is predetermined and semi-formal, and the audience that we anticipate to have is a small group of 20 to 30 participants. This lesson plan will be held in a high school classroom, and it will begin by asking the students what they know about STIs. Anyone who does participate receives a small incentive, whether it's some kind of swag that we may offer through the organization or candy, just really depends on availability. The target audience for this presentation is high school students in grades 9 through 12. The age of these students range between 13 and 18 years old. They will need to be educated on different types of STIs, importance on getting tested, risk reduction, and when to get tested. They will be taught at a high school level, and it's important to be mindful of vocabulary choices. The word sexually transmitted infections will be defined at a high school level, as well as normalizing the words penis and vagina, bodily fluids at the beginning of the presentation, as well as a little overview on, the importance of being respectful in the classroom and things of that sort. Participants for this presentation will be recruited from a local school district that partner with local health organizations that specifically go over topics such as reproductive health. This lesson plan will be designed with an emphasis on preventing STI or stopping STI transmission, and also really emphasizing the fact that STI transmission is very high in prevalence in the United States. There's evidence that suggests that 1 in 4 sexually active adolescents and adolescent females has an STI such as chlamydia or human papillomavirus, also known as HPV. And the top 3 ethnicities from highest to lowest that are more susceptible to contracting an STI is other mixed races, Black and Hispanic/Latinos. And then this lesson plan will focus on STI education for adolescents, specifically behavioral risk factors and what they can do to kind of decrease the chances of them transmitting or contracting STIs. STI education will address not only choosing abstinence and limiting sexual partners, but it's also going to discuss healthy behaviors such as or unhealthy behaviors such as unprotected sex. The risk factor was selected because unprotected sex is the most important risk factor associated with adolescent STI transmission. Sexually transmitted infections are a significant public health issue, specifically in the adolescent range. Adolescents are at a higher risk of contracting STIs due to several things, including behavioral and social factors, as well as biological. Some of the smart learning objectives that will be discussed or that are anticipated to be learned is by the end of the lesson, students are going to be able to explain 3 methods of STI prevention, including condom use, getting tested regularly, as well as vaccination. So there's vaccines for certain STIs that can help them preventing from contracting them. And then for a skill objective, we do anticipate the class to run around 60 minutes, so an hour. And in that hour, students will be able to demonstrate their knowledge by naming and describing at least 3 prevention methods that are going to be discussed. Attainable objective. So these prevention methods will be clearly explained with visual aids and demonstrations, as well as some activities to engage the audience. The attitude objective. So by the end of the lesson, students will demonstrate a positive attitude towards responsible behavior by expressing the importance of STI prevention and being open-minded when discussing sexual health in a respectful and non-judgmental manner. Participants will be asked to brainstorm and quickly create some ideas about what they've heard about STIs. This will create and generate ideas and also group participation. So I would just write on the whiteboard anything that comes to mind for the students. It's a really good method to use because it allows the audience not have to really think hard about what they're going to say. They could just say what the first thing that comes to mind. Anyone who participates does get an incentive. I will also be using case studies to briefly provide information around the population prevalence of STIs, just so that they could get a better understanding of how big of an issue STIs in the adolescent population is. Demonstrations will also be used showing the audience how to use a condom and dispose of a condom using a demo penis in a condom. So we have an activity called the condom race for anybody who wants to engage in the activity or participate. They will get a prize. But essentially, once I go over the steps of how to use a condom and how to dispose of it, there's a race. So whoever can do those steps the fastest wins, and they will get a prize. Using audio visuals that can be seen and heard to enhance the presentation. I specifically will be using a PowerPoint presentation that is semi-formal. And the method I will be using the least is a lecture, and this is because teen or adolescents are less inclined to receive information from a presentation where it's only lecture and just somebody talking. The key take-home message that I want to leave with the audience is prevention. So STIs can be prevented, and it's important to be knowledgeable about their actions, and also being personally responsible of their actions, so making informed decisions about sexual health. The importance of using condoms and other safe practices to reduce risk. And it's important to get regularly tested for anyone who is sexually active, even if they don't have symptoms or they're in a monogamous relationship. Thank you.